And if this is a successful event, maybe in the future we'll continue to do more of these events in the future, or if this one is successful and well attended. So again, thank you for joining us today. And I'd like to start the meeting by introducing our Chief Operating Executive, Mara Bryant. She's the one that runs the day-to-day operations here at the hospital. She'll share with you what we're doing here at the hospital, or the status of our hospital today.
Thank you, John. It is such an honor to serve this community. The hospital is busy, serving both COVID and non-COVID patients. We have created separate environments for each group of patients to keep everyone as safe as possible. If you have come to the hospital recently for care, you have experienced our screening processes with both the temperature and symptom checks. Our environmental services staff are constantly sanitizing surfaces, and we have disinfecting robots that move through the hospital, creating that extra level of disinfection. Thanks to the fact that we are part of a larger healthcare system, Adventist Health, our personal protective equipment and patient care supplies are in excellent shape. And that is no easy task when you consider that we use 700 face shields, 1,600 pairs of gloves, 3,000 surgical masks, and 4,000 isolation gowns every day. We are still in good shape with our COVID medical equipment, such as ventilators and high flow oxygen. We have the needed medications, and the state of California has been generous in sending us the newest breakthrough COVID treatments. The first COVID peak back in July allowed us to develop very specific pandemic systems and processes, like our daily coordination calls, converting units to care for COVID positive patients, and our COVID screening processes. All of those things are second nature to us now. We realize this second surge may bring some new challenges and are confident in the preparation activities we have taken. We are your hospital, and we are here to serve you. Now I'd like to introduce to you our medical officer, Dr. Takahashi.
Thank you, Mara. We've had a great opportunity to go ahead and assemble a great group of folks to help educate you folks and give you insight in terms of what's happening in the latest with COVID, and also an opportunity for you folks to ask questions at the end of this discussion. So I encourage everybody to please utilize your question and answer button to go ahead and submit your questions, and we'd be happy to go ahead and address as many as we can during this time. We're going to have a number of panelists, as I mentioned earlier. I'd like to introduce them. Number one, we have Dr. Juan Barrio. He is the director of our internal medicine residency program. We have Dr. Stephen Liu, who's the medical director of emergency services here at the hospital. And we also have Dr. Geny Zapata, who is the director of behavioral sciences for Adventist Health White Memorial Family Medicine. At this point in time, I'd like to go ahead and first introduce Dr. Liu, who will be giving an update on the ED and why we shouldn't delay care.
Hi, thank you for listening today, and thank you for joining us. While we are always ready to see you in the emergency department 24/7, 365, my hope is that we actually never do see you. And so even before you get to the ER, there are kind of a few things that you can do to try to avoid coming. First and foremost, if you have a primary care doctor and are able to see a primary care doctor, please continue to follow up on all of your appointments and your lab testing and your x-rays that your doctor schedules for you. All of the things that were important that your primary care doc was doing before the pandemic is just as important as it is now during the pandemic. And so please continue to try and see your doctor, call them, make the appointments, because so they can continue to provide that regular care for you. But if something changes and you need to come into the emergency department, we are ready. The emergency department is open, it's safe, and we're ready to go. Please don't wait. You know, anything that you would have come in for before the pandemic, I think it's important to come in for during the pandemic, such as chest pain, belly pain, any weakness, slurring of your speech, difficulty breathing. Or if you're just not feeling well, or if you're concerned about anything, we're here for you 24/7, and that's our job, and we are happy to take care of you. Definitely don't wait. If you're concerned about something, please don't wait. What we don't want is for something small to become something big because you were concerned about not coming in to see us. Once you arrive at the emergency department, we have a very robust triage process, and we really do our best to keep the COVID patients or the possible COVID patients separate from the non-COVID patients. And so while we all have concerns about going out into public and we all have concerns about being around other folks who may be sick with COVID, we separate those patients out in the emergency department very quickly and very early in their stay. And so that hopefully will keep everyone safe. Please wear your masks, socially distance as best you can, wash your hands. The most important thing is we want you to stay healthy, because in an ideal world, I would not have to see you during this pandemic or even after the pandemic. So please take care of yourself.
Thank you very much, Dr. Liu. I encourage everybody, if you have questions, please feel free again to enter them into the Q&A box. At this point in time, I'd like to go ahead and reintroduce Dr. Juan Barrio, and he will be talking about testing and holiday safety tips.
Thank you, Dr. Takahashi. It's an honor to be here, to be asked to be here. I'm going to be talking about prevention, testing, and also suggestions about where to get tested if you feel like you need to get tested. First of all, just like anything in medicine, the best way to deal with COVID is not to get it. So prevention is key. So if at all possible, stay at home, work from home. If you have to leave your home, please wear a mask. Our recommendation to you as providers is to please limit any gatherings more than one household. Please do your best to, to isolate as much as possible and only leave the house for anything that is essential. As far as masks go, the surgical masks are fine. The cloth masks are also good. I've seen a lot of people wearing the N95 types with the exhaust ports. The N95s are the best, but actually the ones with the exhaust ports protect you, but because of the exhaust port, they don't protect others. And the whole point of wearing a mask is to protect others from you. So please keep that in mind. The one thing that I would tell you about wearing a mask is that a bandana is not a mask, and that's actually proven to be worse than not wearing a mask. So please stay away from those. The next thing is if you need to get tested, if you feel like you have symptoms or you've been exposed to someone that has tested COVID positive, please go to your doctor. As Dr. Liu said, we want you to follow up with your doctor, go to the office for anything that is non-emergent. Go to your doctor. However, if he is unable to test you or he won't, or he or she won't test you, you can go to lacounty.gov. LA County is now providing free testing. They may bill your insurance if you have insurance, but yeah, you will not have a copay. And even if you do not have insurance, this is a free test. You can go to lacounty.gov and there's easy to follow instructions on how to get tested for free. The last thing that I want to go over is the types of COVID tests. So the most common test, the one that you've heard about everybody getting in their mouth or in their nose, is the viral test. And this looks at either the virus particle or it looks at special proteins on the virus. And that tells you if you're currently infected. The antibody test, however, you may have also heard about that as well. And basically it says if you have antibodies to the virus, and it's basically an indication of previous infection, not current infection. And even though you may have antibodies, it doesn't tell you when you were infected. So it doesn't always mean that you're immune. So keep that in mind. So in closing, I'd like to thank everyone for inviting me. It's an honor to speak to all of you. And the best way to combat this is to not get it. Please stay at home. We're seeing a surge within a surge right now from Thanksgiving, and we're all busy. We're all able to handle it currently, and we feel confident in our ability to care for the patients in our community. But the best way for you to stay safe and to stay healthy is prevention, is to not get it in the first place. So please stay at home, stay with your loved ones, and have a happy virtual holidays and Merry virtual Christmas. Thank you.
Thank you very much, Dr. Barrio. We'll move on to the next segment, and I just want to reaffirm and remind everybody, if you do have questions, please feel free to submit them through the Q&A box. I'm going to be briefly transitioning to myself, and we'll be talking a little bit about vaccines that are forthcoming. At this point in time, we know that it's an exciting time as we have hope on the horizon, and we expect that vaccines will be in our midst very soon. If you had to go ahead and ask us in January if we would be at this point, I would have been the first to say no. And I was one of those because I didn't think we could do it so quickly. All we had at that time was really the genetic sequence of the virus in hand. And now we have 2 large placebo-controlled studies for this. I do think it's reassuring that the United States, it's going to be re-engaging with the World Health Organization in January. I know that we have been disconnected as of late, but the important thing to note is that pandemics don't pay attention to national borders, and we need to avoid pressures to be parochial and small-minded. I think that's important. In terms of laying the groundwork for what vaccines do, I want to go ahead and give you a little bit of background about what happens with a normal infection. Usually something as simple as a cold or a flu, a lot of the symptoms you get really are side effects related to what your immune system is doing. So your immune system is kicking into high gear, trying to go ahead and fight this virus. Temperature sometimes goes up, and that's a sign that you're trying to go ahead and get rid of the virus itself. Now, the difference when you go ahead and get a vaccine that's being injected into you, you're actually trying to go ahead and trick your immune system and fooling it to think that it's under attack by a virus. At that point in time, you can go ahead and have a ramping up of your immune response, and your antibodies will be produced in order to go ahead and fight the infection. Now, with the COVID infection, you're dealing with a specific type of vaccine that's available right now. It's called an mRNA vaccine. And in simple terms, what you're trying to do is trying to teach cells in our body how to go ahead and produce a protein, or maybe even a small portion of a protein, that the immune system can go ahead and recognize as foreign. So again, you're tricking the immune system to thinking that the virus is in you, and it will respond appropriately. It will produce antibodies, and that response will typically be even greater than the native infection itself. So that's one thing, and how these mRNA vaccines work. Just to give you a little bit of background in terms of the 2 companies that are producing vaccines, you have both Pfizer and Moderna. Pfizer enrolled about 44,000 people in their trial, and Moderna, I think it was a little over 30,000 people. To give you a little context on what this means, we've had vaccines before, such as rotavirus, and that was an enrollment of 70,000 people, and human papillomavirus, it was only 30,000 people that were enrolled. Now, with the COVID vaccine, we have only a couple months of data, and people are wondering, well, isn't that scary? Isn't that a risk? In reality, it's probably not as big of a risk as we think. We know that data from previous vaccine trials have shown that most side effects with vaccines happen within a 6-week period of time after the injections. Now, if a vaccine's gonna go ahead and be effective for a couple months, it's likely gonna be effective for longer. But that's the part that's unknown right now, is how long will this vaccine be effective for us? We talk about 95% efficacy. And yes, that's relating more to the 2-month period of time. We don't know the long-term efficacies, whether it's going to be good for 2 months, 6 months, a year. We might have to think about further boosters if we're encountering issues. But that's something that we will go ahead and be monitoring as a world, and it's going to be important. We're not going to go ahead and wait for 2 to 3 years as a standard trial would be for this vaccine, because you've already had over 290,000 people succumb to the virus just in the United States alone. So time is of the essence to go ahead and do that. And we are going to have to live with that little bit of uncertainty. Side effects in general are very low, and it's something that we have to go ahead and keep in mind. For instance, you have vaccines such as polio. Perhaps you have 1 out of 2.4 million people who had a problem with it, or Guillain-Barré with the flu vaccine, 1 per million. Those are just examples of some of the problems that we might face with vaccines in general. Now we know that, for instance, some treatments such as hydroxychloroquine and convalescent plasma, and I feel they may have been contaminated a little bit by politics. And I want to reassure everybody that the FDA is really getting back on track here and doing what's right. You know that Commissioner Juan finally stood up for the FDA, and he insisted for 2 months of safety data following the doses before considering this emergency use authorization. And it's important to note, because he wasn't going to go ahead and compromise the process just for the election. And that's something that I think we have to go ahead and keep in mind. There was a historian in the past named Michael Harris who once said, quote, "The history of drug regulation in the United States is built on tombstones." And what that means is we don't go ahead and just let these vaccines go forward without vetting them properly, because human lives depend on this. And we know that it's very important that we do the right thing for our patients, for the general public, and all of us to maintain safety. At this point in time, I'll conclude my speech on the vaccine, and I'll turn things over to Dr. Geny Zapata, who will speak a bit about mental health and the COVID environment.
Thank you very much, and good afternoon, everyone. Very grateful and honored to be here, and thankful for the information provided by the skills specialists on this panel. I want to start by, saying that it certainly has been a year of growth for humanity, where we have been pushed to exercise our resilience and our adaptive skills and deal with much uncertainty, especially at the beginning of the pandemic. And so in addressing the mental health component of our meeting, I think it is important that we begin by recognizing and honoring that the level of change we to exercise has certainly been stressful and has had an impact on the mental, emotional, and physical health of many people. Anxiety and depression alone in the US has been reported as tripling in numbers in the past 9 months. And as reported by many across the US and the world, individuals have been dealing with worry, nervousness, sadness, frustration, isolation, financial concern or distress, social and racial suffering, and much, much grief and loss. And for many individuals who had previously suffered from mental health conditions, this experience has either magnified or worsened their symptoms. And for many people who normally have been able to cope effectively with different stressors in their lives, this experience has become so demanding that they have found it difficult to manage it emotionally. So as we continue in this pandemic, I do want to note that fear and anxiety about any new situation and the continual wonder of what can happen can be quite overwhelming and definitely has the potential to lead to a variety of reactions and strong emotions. And one of the things that we can do to help reduce our anxiety and fear is to equip ourselves with information that is coming from credible and trusted resources. And today, for example, we have had a panel of experts which provided information on recommendations that give us the opportunity to know that there are things within our control. And they provided clarity on the virus, how medical need is being managed, an update on the vaccine, and provided safety recommendations that we can do as individuals and communities to help reduce the spread of COVID. So let's practice using what we know and what is within our control to help us reduce our fears and worries and deal with COVID fatigue. And COVID fatigue is a real thing. It's the exhaustion that exists as we continue adapting to change due to the pandemic. And in terms of coping, Sometimes the best thing that we can do is help ourselves move through moments in our day. And I do want to share some recommendations shared by fellow colleagues and organizations, which I have called mental health vitamins that can serve to enhance our coping skills. And there are 9 of them that I would like to share with you. And the first one, of course, is taking things moment by moment. Allow yourself to realize that you will have both good days and bad days, and help yourself to respond to each experience by giving it meaning. This is going to be very important to do. And how we can do this is by taking a moment to pause throughout our day, recognize and name what you are feeling. Provide yourself with self-compassion, meaning that you're giving yourself that understanding and space. And, one of the examples that we could use is just recognizing when we're feeling frustrated for ourselves. What am I frustrated about? I know I'm trying my best. Okay, let me just hang in there this very moment to help myself get through the situation, feel less frustrated, and feel better. And additionally, number 2 follows up with some of those examples, getting creative about finding things that you can do or look forward to. Um, Perhaps taking a walk, while exercising social distance and safety guidelines, watching your favorite TV series, having a Zoom game night with family or friends, play a board game, come up with new recipes. Number 3, find reasons to laugh. Humor is quite healthy for our mental health, and it really helps us to disconnect from stressors by redirecting our focus. So maybe exercising, remembering funny moments with friends and family, or watching your favorite comedy. Number 4, there is nothing that beats exercise. And it really is still the number one and best way to deal with stressors and frustration, best method for coping. It helps you to release endorphins and get some of that adrenaline out when you're feeling frustrated or when frustration builds up. So run in place, pull up a yoga or workout session on an app or a website. There are several resources that are free online. Number 5, take moments to stop and reflect and think about how you've grown as a result of this experience. It is very important for us to also acknowledge our strengths. Maybe dedicating a time to just think about it, journaling, making a list. This will certainly begin to think about how to empower our inner sense of strength. Number 6, talk with someone you trust. So sometimes we feel and we find that just hearing ourselves talk about a situation can help us to feel better. And we can also start finding solutions to what we're experiencing by hearing ourselves talk through the experience. Number 7, if you can, please try to avoid and cut back on social media. The continual exposure to stressful information can definitely become overwhelming. And if you're already stressed, this will certainly worsen that experience for you. So we could take care of ourselves, but moderating that for ourselves. Number 8, exercising bonding within our community. Research supports that helping one another or another person has good impact on mental well-being. And we've been seeing this throughout the pandemic. Perhaps somebody offering a neighbor who is of a vulnerable population to go pick up their groceries, other people in the community sharing of food banks and other sources that can help community members have hidden our smiles. So perhaps we can take an opportunity to maybe demonstrate our greetings through more expressive methods, perhaps a wave or, a nod to recognize that we're still connected. And number 9, as hard as it can be sometimes, try your best to stay positive. working on putting things into perspective can definitely fill your cup with hope and continue to provide you with emotional and mental health energy needed to continue moving forward. So as we keep these things in mind, if at any point you notice that you've been experiencing changes in how you feel, how you're acting, or extremely overwhelmed with stress and your symptoms are getting worse, especially after a 2-week period, please do not hesitate to reach out to your healthcare providers or call mental health warm lines to seek assistance. And if you enter mental health hotlines and warm lines on the web, those numbers will pop up for you immediately. I do want you to remember that there are caring people who want to help you, and you need to know that you're not alone. And, in addition to what we can continue doing to help ourselves to cope, I do want to remind us that it's important to recognize that as challenging as this time has been, it has also presented with an opportunity for all of us to grow. So the pandemic has pushed people and communities to adapt mentally and emotionally throughout the different phases. It has put our resilience skills, the ability to cope with stressors, to the test, for sure. And this means that we have been constantly asked to work on managing change, continuing to work to maintain perspective on what is happening to cope effectively, and have had to regularly give ourselves the opportunity to reevaluate our approach in order to be able to get through the days. So we have seen how communities have come together to assist the needs of others, and continuous acts of courage, selflessness, compassion, empathy, and dedication have been demonstrated by essential workers to help us continue moving forward. I do want to say thank you, essential workers, healthcare providers, for coming to work with humanistic, dedicated, courageous, and giving hearts. Please remember to nurture your souls by taking moments to pause and recognize the strength in each other during your workdays. So as I wrap up, I do want us to remember that amidst adversity and sadness, joy can coexist. Recognize absolutely, but please also hold on to moments of experiences of joy, something that has brought on a smile, and things that you are grateful for. Something to keep in mind, especially during this holiday season, where we are all working towards reinventing how we celebrate what is valuable and meaningful to us in very creative ways. So with this, I close, and I wish you all much wellness, safety, and remind you to please take a moment to take your mental health vitamin. Thank you very much.
Thank you very much, Dr. Zapata, and thank you very much for the panelists for your presentations today. I'd like to go ahead and start the Q&A session here, and we'll start right off the bat. Number one question is, where are we in terms of capacity? And I'd like to turn things over to Mara Bryant to help address that question at the hospital.
Sure, thank you, Dr. Takahashi. So being an inner city hospital, we're used to being, we live about between 80 and 95% capacity almost every day of our life. And we look at that mostly within our adult inpatient, which is where it is the busiest right now. Today, we're at 90% capacity, so we're right in the middle. And every day it changes, but we look at it every 4 hours and we evaluate what we need to do. We have a very busy OB service right now. There's lots of babies being born. So that's really great. And our ER is very busy also, as Dr. Liu can tell you. But overall, the hospital is at about 90% capacity.
Thank you, Mark, for that. Next question we have is, I have heard there's more than one strain of COVID-19. Is this true? If yes, will the vaccine protect us all or protect us from all of the strains? And I'll take that question myself. There are more than one strain of the COVID-19 virus. but there is only one serotype. And to go ahead and simplify, what it means is that the vaccines that are currently out there will protect us from the strains that are out there. So I want to go ahead and reassure everybody that there is no significant mutations that will prevent the vaccine from working properly. The next question I have here is, what is your opinion on those with autoimmune disease getting the vaccine, specifically in regards to allergic reactions? And I'll also take that question. Overall, the fear of autoimmune reactions is extremely low. And the reason why I say that is with this type of vaccine that we're pushing right now with the mRNA vaccines, they don't incorporate into the nucleus of a cell. What they do is they incorporate into an area known as the cytoplasm. It's a very short acting vaccine, meaning that it does not incorporate into your DNA and therefore should not have or generate any sort of long-term sequelae or reactions. Another question I have regarding the vaccine in a bit, and it actually has some operational overlap. About 30 minutes ago, the FDA gave the green light for the Pfizer-BioNTech vaccine. What does this mean? When will it be available? And does it still need another approval? I'll go ahead and ask Mara to comment on that, and we can go ahead and provide perspective from the hospital as well.
Sure. So the vaccinations that have been approved so far, the White Memorial is on the list to receive vaccinations. The first set of vaccinations will go towards the healthcare workers that are at highest risk. And then as additional supplies are given, we will continue to push out beyond our walls. So at this immediate point, the only vaccines that are available that are coming to White will be enough to cover our immediate healthcare workers.
Thank you, Mara, for that. And the anticipation is for the general public, look for general availability sometime in the period of April to June, when your local CVS may be able to go ahead and have that. I think that's a good timeline to shoot for. In the meantime, they are going ahead and trying to triage the vaccines in areas of greatest need. Again, I'd like to go ahead and encourage everybody to use the Q&A chat box if there are further questions. If not, I'd like to go ahead and thank everybody for their efforts today. I want to thank the members of the panel here for providing their expertise. I want to thank Mara and John as well, and for all of you for listening to us today. And hopefully you found this a bit insightful. We'd be happy to go ahead and answer any further questions that you may have. And let us know if this is a format that you'd like to contribute to in the future. I thank you all for your time. Happy holidays and be safe.